Good morning, good afternoon, and good evening to everyone, depending on where you are in the world. Welcome. Today's presentation by M. Salim Khan is the first out of the four-part series on COVID-19 natural solutions. And of course, this webinar series is in collaboration with the National Incubation Center, the NIC, Islamabad, Pakistan. So we are based in Leicester, for those of you who don't know, the College of Medicine and Healing Arts. And I would like to invite Mr. Parvez Abbasi Saab. He's a director at the National Incubation Center to introduce you all to himself, our organizations, and to kick off today's session. Please, Parvez Abbasi Saab, please feel free to, inshallah, unmute yourself and please go ahead.
Bismillahirrahmanirrahim. Assalamu alaikum. Thank you very much, and welcome to all of the participants today. I'm really excited and looking forward to today's session. I'm very optimistic that all of the participants, including myself, will have an opportunity to learn. Before I begin, I wanted to basically introduce the platform that we work with at the National Incubation Center. The National Incubation Center is a public-private partnership based in Pakistan, Islamabad, where since 2016, we have been working with hundreds of young technology startup founders to help them build companies that are not only adding value across economies in Pakistan, but also across the world. In addition to our economic growth, we're also very cognizant of the fact that we need to support social impact. And within social impact, health is a very important part. So we have a number of startups which are working in health using technology. But we're also trying to find solutions in and around COVID-19. Before I get into the COVID-19 challenges that we're all facing, we also must be aware that 2020 has been a very disruptive year for many, many people. People have lost loved ones, people have lost health, people have lost their jobs. And it's very important for us to understand the impact of COVID during our lifetime has been probably one of the worst times in our living memory. The world has completely changed. And this is one of the reasons why I think it's a very important subject for us to discuss and see how we can perhaps minimize the impact of COVID. I don't think we can totally eliminate it, but there are potentially ways I hope that we can learn from in ways that we can minimize the impact that it has to us. On a personal level, I can share with you that I was also stuck in the US for over 3 months. And it was quite a frightening time, not knowing what will happen, not knowing that we'll be able to catch a flight to go back home, etc., etc. Now, obviously, we have hindsight and a lot of information over the last 12 months with regards to COVID. In Pakistan, we're very fortunate that it has not had such a significant impact as we have seen in the Western world. And still, we don't know the reasons for that. We need to be, of course, careful, follow the SOPs, wear face masks, do the social distance. But beyond that, what else can we do? We should not just live in fear, rather we should live in hope in terms of what we can do against that. And I hope that today's session will be the beginning of learning how we can actually help to build our own immune system, how we can defend ourselves against COVID. I'm in particularly grateful to the College of Medicine and Healing Arts and Dr. Hakim Salim. Hakim Salim has been practicing TIB from 1978, based out of Leicester in the UK. He's qualified in herbal medicine and nutrition. Hakim Salim is also the director at MohsinHealth Clinic and a principal at the College of Medical and Healing Arts based in Leicester, UK. College of Medicine and Healing Arts is registered in England and Wales, providing professional training worldwide, traditional medicine practices, incorporating modern knowledge and skills. As I mentioned, I think this is a great opportunity for us to learn, not to fear COVID, but to find ways in which we can help ourselves become stronger. As the doctors typically say, prevention is better than cure. At this point, I would like to welcome Hakim Salim and look forward to all of the participants' questions throughout the session as well. Thank you very much.
Assalamu alaikum. Can someone give me a thumbs up, Parvez Saab, if you can hear me? Yes, okay. Yeah, all right. So, you can give me the next slide. So, Bismillah ar-Rahman ar-Rahim. Alhamdulillah Rabbil Alameen. As-salatu was-salamu ala Rasulil Kareem. Thank you very much, Parvez Abbasi Saab and your team. I think it'd be useful and important to share with our listeners and viewers really that, mashallah, it was your idea that we do this. So I'm grateful for your suggestion and I hope it will, benefit the participants. So what I'm going to do over the next 4 webinars, starting with this afternoon here, is to really look at a number of areas. Number one is something which most people are familiar with. We're going to look at number 2, 3, 4, 5, and 6. So today's focus really is going to be on the number 3, which is selected single and compound herbal medicines. Now, for those of our listeners and viewers, I'll as I go along, I'll try and summarize in Urdu as well. तो जी अस्सलाम वालेकुम। पहले तो मैं बहुत ही शुक्रगुजार हूँ कि परवेज़ अब्बासी साहब ने ये मशवरा दिया और उनकी टीम की तरफ से भी हमारे साथ काफ़ी कोऑपरेशन उन्होंने की, तो जिसके नतीजे में ये हम वेबिनार कर रहे हैं। अल्लाह से दरख्वास्त है कि सुनने वालों और देखने वालों को इससे फ़ायदा हो। तो मैं कोशिश करूँगा कि साथ साथ उर्दू की यानी उर्दू का खुलासा भी पेश करता जाऊँ। तो हम काफ़ी चीज़ों पे तबसरा करेंगे, मगर आज का जो वेबिनार है इसका बुनियादी मकसद ये होगा कि हम फितरती तरीके से किन अद्वियात से फ़ायदा उठाकर अपने और अपने ख़ानदान को महफूज कर सकते हैं इस वबा से। So, as I said, today's webinar is focused on natural medicines and remedies. आज का यानी हमारी तवज्जो जो आज होगी वो फितरती अद्वियात के ऊपर होगी। I thought it'd be useful just to have a very quick, brief review of really what is called plague in the earlier times. Humanity has been dealing with plagues throughout its history. And really here are a few highlights from the earlier times, particularly from Europe and Middle East. We will come to the Chinese situation later, and some of you might be familiar with these. तो ये जो वबा और ताउन जिसे कहा जाता है, तो दरअसल बहुत शुरू से इंसानों को इस वबाई अमराज से पाला पड़ा और बहुत सारे जानों का नुकसान होता रहा। तो हमने कहा कि चले ज़रा तारीख़ी मंज़र से इनको देख लेते हैं। तो मुसलमानों के यहाँ भी ये ताउन आया। आप सल्लल्लाहु अलैहि वसल्लम की दुनिया के जाने के 7 साल बाद जो बड़ा मशहूर ताउन है वो शाम में आया था, हज़रत उमर रज़ी अल्लाह अन्हु के दौर में। उसके बाद यूरोप में ख़ासकर जो बहुत बड़ा यानी जहाँ जानों का नुकसान हुआ वो था जिसको ब्लैक डेथ कहते हैं, और कहा जाता है कि उसमें सबसे ज़्यादा इंसानों की जानें जो हैं ज़ाया हुई। और आखिरी जो यानी 100 साल पहले जो वबा हुई थी वो थी जिसको कहा जाता है स्पेनिश फ्लू पेंडेमिक, 1918 में हुआ। उस वक्त की एक बड़ी दिलचस्प बात ये है कि तारीख़ी बात है कि उस वक्त हकीम खान साहब के दौर में ये वबा 1918 की हुई थी, तो उन्होंने इसका बाकायदा एक इलाज तरतीब दिया था जो आज भी हमारे यहाँ मौजूद है, और इंशाल्लाह अगर मौका मिला तो उस पर भी बात हो सकती है। What I wanted to share with the readers really is that it's interesting, the last major epidemic was in 1918, and a very famous naturopathic physician or Unani physician of India by the name of Hakim Khan Sahib actually treated many thousands of people, specifically in Delhi, and the protocol and the remedies and the dietary lifestyle that he used, we still have access to that. And again, it's very interesting that COVID-19 has an acute situation, but also there is what they call long-term COVID. And Hakim Saab actually identified and treated many survivors of the 1918 pandemic at that time. Now, COVID-19 started started in Wuhan in December 31st, 2019. It was reported to the World Health Organization by the Wuhan district. By March 11th, 2020, the World Health Organization declared COVID-19 a global pandemic, deemed to be it as the most significant public health emergency since the Spanish flu of 1918, which we just mentioned. Now, this is interesting that how in Wuhan it was reported as pneumonia. तो जो हमारे उर्दू हजरात और ख़वातीन हैं उनके लिए ये मालूमात ज़रूरी है कि ये जो वुहान में जब शुरू हुआ था, ये वबा शुरू हुई थी, तो उस वक़्त ये नमूनिया था, कुछ केसेस थे नमूनिया के। 11 मार्च 2020 को इसे वबा की शक्ल बैनुल अक़वामी अदारा हू ने करार दी। Now, what I want to share really is that we want to look at, these are the latest figures, 3 days old far as we are concerned. Let's look at the death toll. So on the left, you see number, which is USA is the highest death in the world at the moment, followed by Brazil, India, Mexico, UK, Italy, France, Russia, Iran, and Spain. These are the top 10 countries. These figures are taken, I think, day before yesterday, and you'll see on the right-hand side the number of deaths per population per million. Interesting, Pakistan, as Abbasi Saab said, that is very fortunate that it has very few deaths. But here's the next interesting one. Look at this. Look at China, where originally COVID-19 got reported from. So it's fascinating. In a way, there is a lot of hope and information here that how it's so fortunate that how so few people actually died in China. Now, one of the logical thing would be for us to ask, what actually did they do to deal with such a horrific situation in such a successful way? So I hope we're going to share a lot of information on what they did really. These are obviously clinical symptoms of COVID. The main ones being, as you can see, let me just go back for the Urdu speakers. Can we just have the last slide first? Yeah, no, this one. तो देखें जो बात ये जो फिगर्स हैं ये तकरीबन 2 दिन पुराने हैं. तो इस वक्त दुनिया में सबसे ज़्यादा अमवात जो हो रहे हैं वो अमेरिका और उसके बाद फिर ब्राज़ील और इंडिया और मेक्सिको, यूके, और आप देख रहे हैं. तो जो इसमें हमारी दिलचस्पी की बात है वो ये है कि अल्हम्दुलिल्लाह पाकिस्तान में बहुत कम अमवात हुई हैं, और चाइना जहाँ से ये वबा शुरू हुई है ऑफिशियली, वहाँ पे बहुत कम लोग जो हैं वहाँ पे मरे हैं. तो हम देखेंगे इस प्रेजेंटेशन में कि उन लोगों ने क्या क्या अक़दाम उठाए जिसकी वजह से इतने कम अमवात हुए उनके यहाँ. तो ये हैं यानी clinical symptoms of the COVID-19, major ones: fever, cough, fatigue, discharge matter from throat and lungs, or shortness of breath, or loss of taste and smell. तो ये अलामात हैं इस वबा की. और जो risk factors हैं, as you can see, these are age being the most predominant, and then obesity, diabetes, cardiovascular diseases, and respiratory diseases. Now let's look at what Chinese actually did for COVID-19. There are a number of reliable publications which say that the efficacy of the treatment for COVID-19 with traditional Chinese herbal medicine was 90%, reported 90%. The Chinese nation has experienced more than 300 epidemics in its history. And in most cases, their traditional medicine, which is mostly herbal medicine and acupuncture, is the first line of action. And as you can see, traditional Chinese medicine goes back over 5,000 years. So दिलचस्प बात यह है कि जो रवायती तिब्बी तरीक़ा चाइनीज़ का जो रवायती इलाज है उसकी अफादियत 90% रही है इस वबा में. बैनुल-अक़वामी अदारा वर्ल्ड हेल्थ ऑर्गेनाइजेशन का एक सीनियर एडवाइज़र है, उसने कहा फरवरी में गुज़रे साल उसने कहा कि चाइनीज़ तरीका इलाज जो है सिर्फ वो ही इसमें कामयाब रहा है. Interesting that the World Health Organization senior advisor says that the Chinese method is the only one that has been successful in dealing with COVID-19. What is interesting is that none of the medical staff who were working with patients in traditional Chinese hospital or using traditional Chinese method actually got infected. This is very interesting for our brothers and sisters, especially who are in healthcare and who are not aware of these facts. Again, some interesting information here. Now, in the first phase, the patients were really treated with traditional Chinese herbal medicine and acupuncture only. Now, I just want to expand our subject a little. As you can see, herbal medicine and actually has been around for thousands of years and continuously practiced and used by various communities. So we're going to look at how we can benefit from those. We're going to try, as we already said, look at traditional Chinese medicine and how it can help us. to prevent and manage COVID-19. Ayurveda, Hippocratic, or what we call Unani medicine, prophetic medicine or Tibb al-Nabawi, and complementary and alternative medicine. तो हम कोशिश करेंगे कि ये जो 5 चश्मे हैं या ख़जाने हैं, रवायती तिब, चीन की तिब और आयुर्वेदा और तिब यूनानी और तिब नबवी और जदीद दौर की जो फितरती तरीके इलाज हैं और उसकी जो रिसर्च है उससे हम फ़ायदा उठाकर कैसे कोविड से महफूज रह सकते हैं और इलाज कर सकते हैं. तो हमारा जो बुनियादी मकसद है वो ये है कि इस वेबिनार में हम आपको महफूज और मुअस्सर और सस्ती और बआसानी जो अद्वियात मिल सकती हैं वो आपके सामने रखेंगे. So we're sharing really solutions which are safe, effective, affordable, and easily available to empower the individual towards better health and prevention. At the root of all those traditions really lies this idea that each individual has an innate power which in Unani Tib is called Tabiyat, that this is the intelligence or the power that really helps us to preserve our well-being and develop our immunity. So everything that you're going to hear really centers around how to use this intelligence, which in modern terms we could call part of this intelligence is the expression of the immunity. क़ुव्वत मुदाफ़ियत जिसे हम उर्दू में कहते हैं कि उसको किस तरह हम मजबूत करें ताकि इस वबा से हम और हमारा ख़ानदान बच सके. And again, this is the administrator, protector, and healer within each person. So unlike post-industrial concepts of a human being, we actually subscribe to human being purposeful and intelligent, and the vital force is also a form of intelligence which can help us to look after our health. Again, the prophetic medicine, Tibb al-Nabawi, is really based on the respect of knowledge. And again, the Quran tells us really that one of the mission of Prophet Muhammad Sallallahu Alaihi Wasallam was to help enlighten humanity in holistic sense and to teach them how to live a healthy, pure life, both at spiritual level, at community level, but also at mental, emotional, and physical level. So we'll be sharing things from the Blessed Messenger and their own lives and how they gave us guidance to deal with infections and pandemics. तो आप सल्लल्लाहु अलैहि वसल्लम जो हैं उन्होंने जो कुछ ख़जाना हमारे लिए और हिदायत छोड़ी हैं वबाओं से महफूज रहने के लिए और इलाज के लिए वो आपके साथ हम शेयर करते रहेंगे इंशाल्लाह. So it's interesting again that we find in the prophetic legacy that one of the earliest reference to isolation and prevention is in the prophetic tradition, that if you hear of an outbreak of plague in a land, do not enter it, but if the plague breaks out in a place while you are in it, do not leave that. And really for over 1400 years, one of the guiding light has been this particular saying, and the idea of isolation and quarantine actually emerges based on this concept of the prophetic guidelines. Now let us move over really to very specific remedies in terms of herbal remedies. So we're going to look at 4 specific remedies which are known from those 5 streams that really they help to strengthen the immune system and help in the prevention and management of COVID. So let's look at the first one. Most of you will be familiar with the black seed. हब्बतुस सौदा इसको अरबी में कहते हैं और कलवंजी शुनीज इसके उर्दू नाम्स हैं. Again, the Prophet ﷺ said that this black cumin is a healing for all diseases except death. So you can begin to see the profound wisdom behind this, and let's move forward with it. तो ये कलवंजी हब्बतुस सौदा का जायका जो है वो तेज़ चरपरा और कुछ कड़वा है. It has a taste which is pungent and somewhat bitter. It has many other names, and it's interesting that it's found in the ancient Ayurvedic Sanskrit literature known as Krishna Jira, and in Chinese medicine as well. And it's mentioned in the Bible as a black cumin. So you can begin to see the confluence of various traditions, both medical traditions, but also revelation traditions, how knowledge is common to humanity. As I said, it's been mentioned in the Bible. It's been used almost continuously for at least, since 1,000 years before Jesus, peace be upon him. It was also used and mentioned by Hippocrates. बुकरात ने भी इसका लिखा भी और इस्तेमाल भी किया है. I just give you a few minutes to just read this so you get the key to why black seed really can help us in this situation and in many other situations to strengthen the body's immune system. तो कुव्वत मुदाफ़त को ये एतदाल पे लाता है और उसको तक़वियत देता है. मिजाज इसका गरम है, गरम खुश्क है. So the core of the black seed is that it strengthens and stabilizes the immune system, supports metabolism and digestion, and lowers blood sugar. And this slide is important because, as you see, it gives you the type of preparation and the dosage. So on your left-hand side of the screen, you'll see the type, for example, seeds or oil, and how much it is recommended for an adult and how much for a child. And then on the right-hand side, you'll see the prevention. Do you think we can move that so people can see that? Is that better? The only caution really with the use of black seed is that it is not to be used during pregnancy. तो हब्बतुस सौदा जो है दौरान हमल इसका इस्तेमाल मुनासिब नहीं, यानी इससे नुकसान हो सकता है, तो ये एहतियात है. The next one we want to focus on is the raw organic honey. शहद के ऊपर. Again, the blessed, glorious Quran mentions the honeybee and its something about it, and it mentions the honey itself. Again, it has many different names. It's used by people from right across all cultures and faiths and religions, including the mainstream natural traditions of healthcare and medicine. And there is a little description of it. Again, it has many uses. Again, it's been used right across human history and human cultures. Today, there are actually thousands of studies on the benefits of honey in incurable conditions, from wounds that don't heal to building immunity. Again, this is how to use honey and how much to use for prevention as a prophylactic and for dealing with the acute condition. Again, you can combine the honey with the black seed, and it actually is much more powerful and better, especially for children, because it's much more easier to take. तो कलवंजी और शहद का आप मुरक्कब भी बना सकते हैं, और इसकी मिक़दार खुराक जो है वो लिखी हुई है. The next we want to talk about is ginger. Again, fascinating how the Quran mentions ginger. Quran Kareem में भी इसका जिक्र है. Again, basically ginger is used in Ayurvedic tradition, in Chinese herbal tradition, in Arabian Hippocratic tradition. It's a safe home remedy, but very useful and powerful. Again, its taste is that pungent and aromatic, and its temperament is fresh ginger is usually hot and moist, while dry ginger is hotter and drier. So here then again, we see that it's actually very good for cold conditions, viral bacterial causes. And again, this is the preparation and the dosage. So again, fresh ginger, you can take much more than the dry ginger for prevention, and then for management, basically the rule is that you use it 3 times a day. Again, ginger can be combined with honey as well if you wish. Finally, we're going to look at something which is, I mean, they're all amazing, but really, let me share with you first, and then we'll come back during the questions and answer sessions. तो ये बर्ग ज़ैतून पे बात हो रही है इंशाल्लाह. Again, fascinating how the majestic Quran describes really the olive tree. Again, the olive leaf is specifically mentioned in the New Testament. The tree of life whose leaves are for the healing of nations. Again, उसको उर्दू में से बर्ग ज़ैतून कहते हैं, अरबिक में olive leaf, और Chinese भी इसको इस्तेमाल करते हैं. Again, interesting that it's used all over the world. Again, its taste is bitter, very bitter actually. Temperament is warm and dry. Fascinating, it's antibacterial, antiviral, antifungal, hypoglycemic, hypotensive, gets rid of the fevers, and vasodilating. Here is a quotation from one of the contemporary researches on olive leaf by the name of Dr. Morton Walker. He says that I'm convinced that olive leaf extract is destined to become the most useful, widespread antimicrobial ingredient of the 21st century. Again, here is the preparation and dosage. And it can be made into a beautiful and healthy tea on a regular basis for prevention. And also you can mix honey if you wish, or you can use olive leaf capsules or powder, and you can use olive leaf tincture for those of you who are in areas where tincture is available. Again, it can be used for the management and the prevention. So, thank you very much. Those are the 4 remedies really which we selected for you to benefit, both in terms of strengthening the immune system and hopefully preventing the COVID. And unfortunately, if any of you, your family or patients suffer, then you can, as I said to you, we shared the protocol that you can actually triple the dose. I didn't go into too much research. For those of you who are interested in the research, there's tons of information from those streams that we discussed, but also today there's so much information on each and every one of those 4 remedies that we discussed. So I hope that I kept it intentionally simple and clear. Let me just do a very quick resume of some of the things in Urdu, and then we'll take some questions from yourselves. तो ख़वातीन और हज़रात, उम्मीद है कि आप को इस वेबिनार से इंशाल्लाह फ़ायदा होगा। तो हमने 4 मुफ़रद अद्वियात का ज़िक्र किया है, यानी कलवंजी, शहद, अदरक और बर्ग ज़ैतून। तो जानबूझकर इनको हमने इसलिए इंतखाब किया है कि एक तो ये फितरती चीज़ें हैं, हज़ारों सालों से इस्तेमाल की जा रही हैं, इनकी अफादियत के ऊपर कोई शक व शुबा नहीं। जदीद तहकीक जो है वो भी इन सब अद्वियात के ऊपर इतनी है कि आप हैरान हो जाएंगे, और ये बड़ी सस्ती हैं, घर में इस्तेमाल की जा सकती हैं, वबा से बचने के लिए भी, और खुदा न खास्ता अगर कोई वबा का शिकार हो जाए तो उसके इलाज के सिलसिले में भी। तो उम्मीद है कि ये सारी मालूमात आपके लिए आसान होगी और मुफीद होगी। तो अब हम ये चाहेंगे कि कुछ सवाल और जवाब हों। अगर आप लोगों की तरफ से कोई पूछना हो तो बिस्मिल्लाह शुरू करें। So I think we're going to open up for questions and comments and observations. We have about 20 minutes. So Hussein, how are we going to do that?
Assalamu alaikum, Hakim Salim. Yeah, so the way that we'll take the questions will be through the chat. So I've just opened up the chat. For those of you who have questions about anything which has been shared, feel free to post them in the chat, and then we can go through them. Obviously, we have hundreds of people attending, so bear with us. We perhaps won't be able to get to everybody's question, but we'll try our best. Similarly, if you're watching on Facebook, I am keeping an eye on the Facebook Live forum, and so do comment in there. Again, we'll try and get to everyone if possible. If not, please do excuse us. So already we have some questions coming in on Zoom. So let's just go through them. So one question, Talha is asking, Assalamu alaikum, by triple degree, Do you mean the strength or frequency of the dosage?
Okay. So excellent question, really. So the frequency needs to be tripled. So it's the number of times that a particular individual remedy or the combination needs to be used. So for example, if I was using it once a day as a prophylactic, as a prevention, I would need to use it 3 times a day.
Thank you. Another question is, does our temperament affect what medicines we should take, or can we use all of them regardless? From Sarah Idris.
Okay, the temperament really in this situation is if an individual is actually suffering with acute condition, then really the temperament in terms of the remedies doesn't matter. But if they're using it as a preventative, prophylactic, then they need to be aware that certain temperament, for example, if a temperament is like summer, hot and dry, and they use one or more of these remedies, then they need to be just cautious and be aware and maybe reduce the dose or use something to lessen the heat and the dryness of a particular remedy or a combination.
Next question. So Nasser is asking, why is it that you shouldn't use black seed during pregnancy?
The use of black seed during pregnancy, because it can lead to problems, and this is well known both empirically and in terms of research. So really, in this seminar, I think we don't want to go into too many details of the chemistry and what it's going to do. It's really contraindicated, i.e. it's not to be used during pregnancy.
Okay. The other question is about, there's 2 questions about olive and olive leaf. So Hamza asks, does eating olives have the same effect as olive leaf? And then the other question asked by Serish is, it's really hard to find olive leaf. Are the capsules or extracts of olive leaf acceptable? So one is, do the olives have the same effect as the leaf? And secondly, is capsules or extract acceptable?
So the answer to the first question is really no, olives are not acceptable because the effect of the leaf is much more powerful, and it actually has what in modern chemistry we would say the active ingredients. And again, is a whole range of chemistry in there, but no, eating olives will not do the job that we are interested in terms of prevention and management of COVID-19. So it needs to be olive leaf. That's the first thing. Actually, olive leaf is found almost all over the world. I'm not sure if the questioner, where are they from, but olive leaf is now available in many countries. So it should be easily available. Now, in terms of olive capsules, if they're made by the person or by a reliable firm or organization, then they're acceptable, really. Yeah.
Okay. What's the difference between dried ginger and the other? Muhammad.
Fresh ginger is more gentle and one can use a larger dose, whereas dry ginger is actually much more potent and strong and much much more stronger. So the dose has to be different. It needs to be a smaller dose, whereas the fresh ginger is not that powerful, so one needs to use less of it.
Okay. Thank you, Hakim Saab. Aksa is asking the effects of hot or cold temperature food on the human body. So effect of hot or cold temperature food, she's asking.
Right. In terms of, we have a next week, inshallah, we're going to be talking about and sharing a lot of useful information on the nutrition and supplements. So if it's possible, we can leave that for next week, because the focus next week is going to be on our gut health and the food and drinks, and what particular foods and drinks can aggravate or predispose us towards becoming more susceptible for COVID-19, and which foods and drinks can help us to develop our immunity so that our body is able to fight the COVID-19 much better. So if it's possible, maybe we can leave that discussion for next week. Is that okay?
Thank you. Yeah, and like you mentioned, I think we do have a focus on food and drink next Saturday, same time. So of course we can go into that. So I thought that we can take a couple of questions from Facebook, and I do apologize, a lot of comments have come in, so we can only do a few, but so there's a couple of questions here. One by Georgina Robertson. She's asking, for those with compromised immune systems, are there any counterindications using the recommended herbs?
Obviously, it depends on the nature of the individual person's depth and breadth of the immune compromisation. So, obviously, it's an individual situation for which we can't answer. They need to kind of get in touch with the appropriate healthcare professional. But in general, these remedies that we've shared with you are really, at one level, home remedies and safe remedies which have been used for thousands of years right across human societies and cultures. So personally, I don't think it should be an issue. The only caution I would say that if an individual has a compromised immune, then they ought to try one remedy at a time, gently, and see how it can help them, rather than a combination. So they might try, for example, black seed in the smallest amount of dose, and then see if that can help them stabilize their situation, rather than taking a combination.
Thank you. So many questions here that people are sharing, and so I'm really just trying to. I think some of these questions are for people's individual situations, and as Hakim Sahab mentioned, really, there's only a limited amount that that we can really say in a situation like this. Really, if you get in touch with a healthcare practitioner, then really, you would have to have like an assessment done to deal with your individual situation. So that's, I think, just a blanket guidance for those of you who are asking, about if you got XYZ disease or in a particular condition or situation. It is always better to consult with a natural healthcare practitioner who's qualified and competent. That way you can get personalized advice. Hakim Saab, how many more questions? I think we have 10 minutes on the clock still. So shall we keep going with the questions?
We can keep going, but I like to request some feedback on today, because it is the first time we're doing this short free webinar. So really, I would welcome some feedback, how people have found it and what would they like to see covered in the next one. If you can have a little bit of feedback, so, we can adjust this next week based on your experiences, how helpful you found it, or how, if it wasn't helpful, what would you do different? So I think that kind of feedback will help us to prepare the next session much more towards your needs. And I'm particularly interested in, obviously, everyone's feedback, but particularly interested in those people who are Urdu speaking, to see how it sort of met their needs or it didn't meet their needs, because it's the first time we're trying to do bilingual seminar. तो जो हमारे सुनने वाले देखने वाले उर्दू दान हैं, तो उनसे गुजारिश करेंगे कि आप हमें कुछ बताइएगा कि ये आपके लिए कैसे रहा, हमारे जो टूटी फूटी उर्दू है उसके लिहाज से, ताकि हम आइंदा सेशन जो है उसको बेहतर कर सकें। जो चीज़ें आपने मुफीद पाई और जहाँ कुछ कमी रह गई या कोई बात समझ नहीं आई, ताकि आइंदा के लिए हम आपके मशवरों के ज़रिए इसको बेहतर कर सकें। Okay, Hussein, you can carry on.
Okay. Again, there's a few questions. What I do suggest is, if you have a question, like I said, that is personal to yourself, like you've had a particular experience with a medicine, or you have some sort of condition, like I said, do get in touch with a natural healthcare practitioner. If you want to get a contact for a healthcare practitioner, Hakim Saab does see patients, a very limited amount of patients. So you can get in touch with MohsinHealth. Okay, so what precautions should we apply when giving black seeds to people with respiratory issues? Can it be used pure, or should oil be diluted in other oils?
Right. So actually, there is a lot of historical, empirical use of black seed for respiratory conditions, for various allergies and so forth and so on. So it's excellent for that. I myself really prefer to use the seeds. And then you can powder them yourself at home, very easy to do so, and then to use them in that way. If it's appropriate, you can actually take 1 part of the seed and 3 parts of raw organic honey, and you make it into a paste or into a majun, as we call it. And that's an excellent way of using black seed for people with respiratory problems or issues. As far as the oil is concerned, you really have to be very careful that the oil is genuine black seed oil and of the right quality. So I myself tend to prefer the seeds.
Okay, thank you. Someone's asking, so this is a question from Safia. She's asking, is the olive leaf from the plant one has in the garden fine, or is it a special medicinal grade?
No, actually the olive leaf is from a particular Oliva Europa, so that's a particular plant. But if you have a olive, there are many species of olive, but any olive leaf will do. The only issue will be how much do you use as a dose. Again, my suggestion is there are many reputable companies who actually supply very good olive leaf products. Again, I hope we will be able to share with you the resources where you can buy them. But you can buy olive leaf from right across the world from different suppliers, and some of you, if you have it in the garden, you can use that.
Thank you. Okay, let's some people want to see the slides back again. What we will be doing, just to get everyone up to date on this, is that we will be sharing some key information from today's presentation to those of you who have registered. So you will actually receive an email in the next few days, which will give you some of that key information, right, including about the herbs. Okay. So many questions. Honestly, it's so hard. I'm just going to go in the order that people have posted, honestly. So someone's asking, among all these remedies, which one is the best and effective for this purpose, according to you?
Okay. I just want to remind you, Hussein, that we only have about 3 minutes. And really, we're going to try and finish by 2 o'clock. Now, in terms of my experience, really, if there was one, you know, it's so hard. How do you choose between wonderful 4 people? If I was on a desert island disk, if I was there, I would actually choose, if possible, the olive leaf. That would be my favorite, the olive leaf. But, you know, I am tempted towards that. But any 4 of these, as long as you use them on a daily basis. Now, the secret really is to use 1 or more of these on a regular basis. So, for example, my personal regimen is that I take warm water first thing in the morning, a glass of warm water, not warmed in microwave, but really warmed in other ways. And I use regularly, almost without fail, black seed, and I use the black seed as the seed. So this is one. On certain days, I combine raw organic honey in warm water with the black seed. If you started your day like that, try it and you'll be amazed. And then I try and use olive leaf tea at least once a day, maybe in the afternoon or evening. And for those of you who haven't had a chance yet to actually taste the olive leaf tea, you'll be amazed how beautiful it is and how beneficial it is. So, Hussein, if I have your permission, and if I have the permission from Parvez Abbasi Saab and his associates, I think we're coming up to 2 o'clock. So, if I can ask the permission of Parvez Abbasi Saab and Hussein, I want to thank Allah for giving us this opportunity, a wonderful opportunity to share this life-saving, beneficial knowledge, which is so safe, so effective, so economical, and so easy for everyone and anyone to actually have it at home and use it to improve their immune health and their families and their friends and their colleagues. So this has been really a great honor and a privilege for the College of Medicine and Healing Arts through the help and collaboration of Parvez Abbasi Saab and his team and Hussein. And finally, thank you for those of you who joined us. God bless every one of you and all of you. And we really look forward to some constructive feedback from yourselves on how useful you found today's webinar and what would you really like us to help and prepare for you for the next week, which is focused around nutrition and supplements. And the one after that is around lifestyle and personal care, and the final one around psychological and spiritual dimension of the health and well-being, with a particular focus on prevention and management of COVID-19. So thank you so much for being with us. Keep safe, keep well, and look forward to meeting you next week at the same time and same place. Jazakallah khair. Thank you so much.
Thank you very much, Hakim Saab. It's a pleasure to host you. And I'm sure that, like myself, many people found it useful. Hakim Saab visited us in Pakistan a few months ago, and we took the liberty of starting to drink olive leaf tree. And I can show you that it has made an impact in my life, and I'm sure that it's going to make an impact in other people's life. Until next week, thank you very much. We look forward to your feedback for improvement's sake, and we look forward to, inshallah, connecting with you again. Hakim Saab, thank you very much, and all the team who have behind the scenes put this together. Appreciate your help, appreciate your support. Until next time, Assalamu alaikum.
Wa alaikum assalam.